Hello guys, welcome to our channel. Today we are going to discuss about the 7 days to FMG examination. This is the final edge for the 26th July examination. 1 week, one goal. We have to make sure that we are going to clear this examination in the very first attempt, and this July examination is going to clear by every student. Okay, so please don't stop right now. This is the time you have to show up and give your best. So let's start our video. Don't forget to subscribe and share with your friends. So rule number one, always remember you have to stay positive no matter what. You may see the low scores, you may see the low edge points, everything you may see, but never give up. Okay, always stay positive. Okay, and be confident about yourself. You have given the 6 months or you have given the 1 year of the time, whatever, but you have to be confident because this 1 week is not going to change anything. At least this 6 months you have given your hard work. Make sure that you are going to stay confident until the examination hall. Okay, and believe in yourself no matter what, whatever you did, whatever the course you have studied, whatever the revision pattern, schedule pattern, everything you had, you are given your best. So believe yourself, your hard work, your dedication, discipline is going to matter on the examination. So don't trust and don't see your cons than the pros. You have many pros but only few cons. So trust yourself and believe the process of your studying and trust the process. You never thought you are going to complete the FMG, the foreign medical graduate. You have completed your graduation in the university. You have came here and you are going to appear for this examination. So trust the process. You know you will clear this examination. You are going to give the PG examination and you are going to have the your medical life in the future. So trust the process. Everything have its own time and everything will be going on its way. Okay. So you got to do this. Do the one push away, and in this 1 week now there are many wonders to happen. Okay, and don't forget this 1 week also make sure that you are going to have the good sleep, because if you have any disturbance with the sleep now, on the exam day you will be not able to concentrate in the examination hall. You will be having the anxiety issues and you will be feeling the very drowsiness also. Okay, so make sure that at least make the pattern that 6 hours or the 5 hours sleep is very adequate in this time. Okay, because you have the two papers, right? You cannot have, you are not like only giving the one paper, you have the two papers. You don't know, you may feel the drowsy in the examination hall also. So try to have the good sleeping pattern so that you can have the examination freely. Can always stay hydrated because our brain itself need the more and more water. Okay, always sleep light, and whenever you feel low now, please spend with your loved ones and please spend with them and talk with them at least 1 minute, 2 minutes now. It will give you the positive energy from them. And next one, the last 7 days, what you should do. Okay, this 7 days is should be done only the rapid revision. What kind of rapid revision? This is like a ultra rapid revision. Okay, this is like a ultra rapid revision you have to do. And what is the thing that you have to make sure that you have to focus on the scoring subjects only? Because see, whenever I say, I always tell that 19 subjects are important. 1 mark is also very important to score in this examination. But in this last 7 days, you have to focus on the scoring subjects. What are the scoring subjects? Such as your biochem. And one of the other subjects is a pharmacology and anatomy, physiology. All these subjects now very good scoring subjects in the paper one. And coming to the majors, you have to make sure that PSM is completed. And OBGYN you have to answer. And also pathology. Pathology questions also most of the systematic disease only. All the systematic disease you have to clear. And ENT and and here itself, I can say these can, if you are perfect in this now, you can easily score the 150 plus. And remaining in the fluke or in the minor subjects, you can easily score the 25 to 30 plus score. So for that, at least we can see 180 plus is easy for this. So make sure that you are going to revise the scoring subjects in this last 1 week, because this can need the very edge type of the revision for you, because immediately after seeing the question from the biochemistry, pharmacology, anatomy, physiology, you can easily answer this question. So make the 7 days pattern for these subjects and use this rapid revision course. Ultra rapid revision, not like rapid revision, making the 2 days for the biochemistry, 1 day for the pharmacology. Don't do like that. And integrate the subjects. How to do the integration of the subjects? For example, you are reading the pharmacology. Whenever you are reading the pharmacology now, open the medicine, systematic diseases, learn from it. And if you are reading the physiology, again go back to your medicine. Okay, again go back to your pathology. These subjects now you can easily integrate. You are reading the anatomy subjects. Okay, if you are reading the anatomy, then go for the physiology. and systemic same again systemic pattern. So do the integration of these subjects. Never give up the integration because it has a very major role. Pharmacology you are learning, physiology only normal function. You are just giving the drug to work as it properly. And medicine, the pathology is inside the medicine, right? That's why we are properly treating this patient. All this, if you do the integration, now you can easily answer. You can easily recall in the examination. Don't read the new topics. This is the biggest blunder the most of the students will do. Never do this one. Okay. This last 1 week now, less time of the revision pattern. So to avoid that revision, like to avoid that confusion and anything anxiety for you, don't read the new topic. Never go with the new topics, any subject. Okay. For example, Dharma, you may think that small topic, you have not read the acne, but you are reading the acne for the first time now. Don't do that. If you are not read now, just leave it. Only revise what you have read already. Okay. Don't go back and don't run behind the new topics. New topics, new topics. Never do this in the last week. Always revise your notes, always revise your sources, always revise your only your trusted resources. That is the only going to be helpful for you. Okay. Next, moving on to the MCQs practice. This is a game changer. Always remember, we have the very beautiful examination pattern that all the questions will be having the only the positive marking, no negative marking for us. Okay, no negative marking, then only positive. Then you have to make this advantage. How can you make the advantage? Do the PYQs. Okay. So I see the so many students only practicing the PYQs from the last 6 months. This is not going to help, guys. But if you were practicing the PYQs from the last 6 to 7 days now, this is going to helpful 100%. This is going to be the helpful for you. So now only and daily make sure that at least 150 or at least 100 MCQs per day from these PYQs. These PYQs can be present in the Marrow platform. It may present in the prep platform or any arrays missed any platform. This will be available. So utilize this. Do the practice of this past 5 years of the FMG. You have the 2 papers in the 1 year, right? And that means you have to do the only like majorly you will be doing the only 10 papers. So that 10 papers is also going to helpful for you. So past 5 years of the FMG papers is very must, and 2 years of the NEETPG papers. Okay, you may have the 2 years means last year itself they have the 2 papers. So practice those 2 papers, and 1 year of the INICT, last January INICT and also November INICT. This will be helpful for you, and you can also see the rapid revision videos of this INICT papers, recall papers in the YouTube. That will be also fine. Because why I am telling you, when I returned the 2024 examination now, I have read the INICT NEET PG, and from these two itself, 20 plus topics or direct topics came from these subjects only. And FMG paper, and I know that almost 100 plus topics are your PYTs only. So make sure that you are going to do this practice in this last 7 days because it is going to helpful for you a lot. Okay. So last 5 years papers, last 2 years, and last 1 year of all these papers now you have to do, and you have to make sure that this will be playing the major role in your examination. Next, visual memory. What is the mean by the visual memory? Whenever you see, you don't know that, but sometimes now in your childhood, whatever you have read, you will be recalling right now. Okay, the image based. So this is going to be the very good recall for you. For example, we have the in the examination itself 30 to 40. Okay, 30 to 40 image based questions only coming. So to write these image based questions correctly, if you can answer correctly now, this is easily like 40 plus score in your examination. 100 you may score from the other subjects, 100 you may score from the all the 19 subjects. But these 40 questions IBQs, if you does not make the any mistake now, this is going to be the very good score for you. 150 plus easily you can score. All right, next charts. What is mean by the charts? They are number of tables, number of Indian like national programs, PHC programs, all these charts are very, very important. And also algorithm, treatment algorithms are many for us in the medicine and the PSM, all these subjects. So for that now, you have to practice these charts. Algorithm, if you have the patient is coming from the atrial fibrillation, if the patient is stable, if the patient is unstable, then what you are going to do? You have to going to do the cardioversion. If the patient is stable, and then you can do the 2D echo. Like this, now these all the algorithms charts you have to practice and calculations. I have never imagined that the FMG or the NBMS is going to adapt this, but they have adapted. What they are doing, at least 4 questions are coming from the calculations. It's only Burns, GCS, or the shock index. That is a part, but they are also giving the odds ratio, relative risk, and many other PSM formulas also asking in the examination. So for this now, you have to practice from now itself. You can use the calculator also. Even in the examination, you will be having the calculator. So practice now also. Whenever you're doing the practicing of the calculations questions now, practice in the calculator itself. If you are making the right answer or the wrong answer, that you have to check. And in this last visual memory, if you are practicing those formulas now, easily you can attempt. And next coming to the instrument. Why I'm telling the instruments? Instruments at least two questions. Two questions only. Why can't we leave these two questions? Remember, 150 is equal to 300. 149 is equal to 0. So two questions never ignore. Two questions also very important. And where is those instruments that is mostly important for you? OBGYN, okay, and surgery. These are the major. And how about the minor? ENT, opta, ortho. This is also commonly asking. Okay, so make sure that you are going to prepare the instruments from these subjects. Okay, never miss those questions also. Last time in the ophthalmology, there is a one question came in the 2024 June examination. Most of the students are don't know what is that instrument also. So if you practice now those instruments right now, at least only the known instruments only. You don't have to run behind the new ones. Okay, the known one, whatever you have seen in your clerk shape, your college, or your in the rapid revision videos, read those only. And next, illustrations. Many resources in the triple R book also we have given the illustrations of the different pathologies, subjects, and also important topics. So for that, please do the illustrations also. Okay. All this visual memory in this last 7 days now, it is going to help you a lot. So these 7 days, never miss the image-based questions, charts, calculations, instruments, and the illustrations. Okay. So don't give up now. So many students will be giving up now. They will be doing the GT or they will be doing the mock test and they will be scoring the less than 140 or the less than 150 and they will immediately give up. So these give up now you should never do. Okay, don't give up now, guys. You have to do it now only. So these can be changing also. So many students I have seen 140 they scored in the mock test or the GT. And in the examination, they have scored the 200 plus. Remember, these scores are not going to reflect in the final examination. So there is still plenty of the choice for you. You can make sure this 7 days, 24 by 7, you can make sure that you can score 150 plus and the 180 200 plus also. It is very important. Okay, this last rapid revision is very crucial for you. You are going to see in the examination hall, you will be having the many so much stress on you, so much anxiety on you. But if you are seeing that first question you have attempted well with your confidence, with your revision, you have helped now, you can easily answer the 300 questions also very smoothly. Okay, so that's why never give up now. This time give the GDs, give the mock test, doesn't matter with the scores. Just see where you are making the mistakes. Which mistakes you have to avoid. Silly mistakes, common mistakes you have to avoid. Only that you have to focus. And remember, 140 in the GD, 140 in the anything, na, you don't know. You can score the 200 plus or the 180 plus also. So don't give up now. So only one thing I have to tell for you, time to trust your hard work. You are going to give this examination, no matter what. You will ace this examination. Remember, you have to conquer this world. That is what I'm expecting for you. And not only all the best, I'm going to tell you guys and advance congrats also. All you are going to, whoever preparing for this FMJ examination, congratulations in advance and prepare well. Give your best in this last 1 week. Practice the PYQs, practice your rapid revision notes, and all the best for everyone. And please do access to our new RR notes. This is the best notes that I can recommend for you. And please do subscribe to our YouTube channel. Soon we are going to update the expected topics and the rapid revision of the other subjects.